Hey, Alpha Nurses, I'm Licensure from AlphaNursGuy.com. This is 30 Practice NCLEX questions. Without delay, let's get started.
When obtaining a history from the parents of a child diagnosed with diarrhea due to salmonella, the nurse should ask the parents if the child has been exposed to which of the following possible sources of infection. 1. Non-refrigerated custard. 2. A pet canary. 3. Undercooked eggs. 4. Unwashed fruit. The correct answer is 3. Diarrhea related to Salmonella bacilli is commonly spread by raw or undercooked fowl and eggs, pet turtles, and kittens. Food poisoning caused by Staphylococcus species is commonly spread by inadequately cooked or refrigerated custards, cream fillings, or mayonnaise. Psittacosis, a respiratory illness, may be spread by canaries. Contaminated, unwashed fruit is associated with typhoid fever, a disorder rarely seen in the United States. A child undergoes rehydration therapy after having diarrhea and dehydration. A nurse is teaching the child's parents about dietary management. The nurse understands that the teaching plan has been successful when the parents tell the nurse that they will follow which type of diet? 1. Regular. 2. Clear liquid. 3. Full liquid. 4. Soft. The correct answer is 1. Dietary management following rehydration for diarrhea and mild dehydration would include offering the child a regular diet. Following rehydration, there is no need for the child to be on a special diet, such as a clear liquid, full liquid, or soft diet. A child is started on a soft diet after having been on clear liquids following an episode of severe gastroenteritis. When helping the mother choose foods for a child, which of the following foods would be most appropriate? 1. Muffins and eggs. 2. Bananas and rice cereal. 3. Bran cereal and a bagel. 4. Pancakes and sausage. The correct answer is 2. After clear liquids, the foods of choice are soft foods. These foods should be easily digested and low in fat. Additionally, the food should be non-bulk forming. Bananas and rice cereal are low in fat and easy to digest. Muffins and eggs, as well as sausage and pancakes, are typically high in fat and will be avoided. Although a bagel is low in fat, bran cereal is high in fiber and would be avoided because it may cause more diarrhea. The stool culture of a child with profuse diarrhea reveals Salmonella bacilli. After teaching the mother about the course of Salmonella enteritidis, which of the following statements by the mother indicates effective teaching? 1. Some people become carriers and stay infectious for a long time. 2. After the acute stage passes, the organism is usually not present in the stool. 3. Although the organism may be alive indefinitely, in time it will be of no danger to anyone. 4. If my child continues to have the organism in the stool, an antitoxin can help destroy the organism. The correct answer is 1. After having S. Enteritidis. Some clients become chronic carriers of the causative organism and remain infectious for a long time as the organism continues to be shed from the body. During this time, the child is still considered infectious. No antitoxin is available to treat or prevent salmonella infections. Which of the following would alert the nurse to suspect that a child with severe gastroenteritis who has been receiving intravenous therapy for the past several hours may be developing circulatory overload? 1. A drop in blood pressure. 2. Change to slow, deep respirations. 3. Auscultation of moist crackles. 4. Marked increase in urine output. The correct answer is 3. An early sign of circulatory overload is moist rales or crackles heard when auscultating over the chest wall. Elevated blood pressure, engorged neck veins, a wide variation between fluid intake and output, with a higher intake and output, shortness of breath, increased respiratory rate, dyspnea, and cyanosis occur later. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at AlphaNursGuy.com. Back to the questions. The primary care provider prescribes intravenous fluid replacement therapy with potassium chloride to be added for a child with severe gastroenteritis. before adding the potassium chloride to the intravenous fluid. Which of the following assessments will be most important? 1. Ability to void. 2. Passage of stool today. 3. Baseline electrocardiogram. 4. Serum calcium level. The correct answer is 1. Potassium chloride is readily excreted in the urine. Before adding potassium chloride to the IV fluid, the nurse should ascertain whether the child can void. If not, potassium chloride may build up in the serum and cause hyperkalemia. An electrocardiogram could be done during intravenous potassium replacement therapy to evaluate for these changes. Having a stool daily is important, but because potassium is primarily excreted in the urine, the child's ability to void must be verified. Serum calcium levels do not indicate the child's ability to tolerate potassium replacement. A 9-month-old is admitted because of dehydration. How should the nurse go about accurately monitoring fluid intake and output? Select all that apply. 1. Weighing and recording all wet diapers. 2. Change breastfeedings to bottle feedings. 3. Obtaining an accurate daily weight. 4. Restricting fluids prior to weighing the child. 5. Obtaining an accurate stool count. The correct answers are 1, 3, and 5. Accurate intake and output recording includes noting all intake, including IV fluids, noting output, such as emesis and stool, weighing diapers, measuring weight daily, measuring urine-specific gravity, monitoring serum electrolytes, and monitoring for signs of dehydration. Children who are dehydrated must receive sufficient fluid intake, but having a breastfeeding child switch to bottle feeding will not promote intake. Restricting fluids just prior to weighing the child will not alter the accuracy of the weight, and the nurse should continue to encourage fluids for this dehydrated child. The mother of a toddler who has just been admitted with severe dehydration secondary to gastroenteritis says that she cannot stay with her child because she has to take care of her other children at home. Which of the responses by the nurse would be most appropriate? 1. You really shouldn't leave right now. Your child is very sick. 2. I understand, but feel free to visit or call anytime to see how your child is doing. 3. It really isn't necessary to stay with your child. We'll take very good care of him. 4. Can you find someone to stay with your children? Your child needs you here. The correct answer is 2. The nurse's best course of action would be to support the mother. This is best done by conveying understanding and encouraging the mother to visit or call. Telling the mother that she shouldn't leave and that the child is very sick is critical and insensitive. Additionally, it implies guilt should the mother leave. Commenting that the child does not need anyone is not appropriate or true. Toddlers, in particular, need family members present because of the stresses associated with hospitalization. They experience separation anxiety, a normal aspect of development, and need constancy in their environment. Asking the mother to find someone else to stay with her children is inappropriate. The children at home also need the support of the mother and/or other family members to minimize the disruptions in family life resulting from the toddler's hospitalization and to maintain consistency. The nurse teaches the father of an infant hospitalized with gastroenteritis about the next step of the treatment plan once the infant's condition has been controlled. The nurse determines that the father understands when he explains which of the following will occur with his infant. 1. The infant will receive clear liquids for a period of time. 2. Formula and juice will be offered. 3. Blood will be drawn daily to test for anemia. 4. The infant will be allowed to go to the playroom. The correct answer is 1. The usual way to treat an infant hospitalized with gastroenteritis is to keep the infant nothing by mouth status to rest the gastrointestinal tract. The resulting fluid volume deficit is treated with intravenous fluids. When the infant's condition is controlled, clear liquids are then started slowly. Formula and juice will be started once the infant's vomiting has subsided and the infant has demonstrated the ability to tolerate clear liquids for a period of time. In this situation, there is no need to test the infant's blood every day for anemia. Most likely, the infant's serum electrolyte levels will be monitored closely. Typically, an infant is placed in a private room because gastroenteritis is most commonly caused by a virus that is easily transmitted to others. Which of the following would be appropriate for the nurse to identify as a priority nursing problem for an infant just admitted to the hospital with a diagnosis of gastroenteritis? 1. Pain related to repeated episodes of vomiting. 2. Deficient fluid volume related to excessive losses from severe diarrhea. 3. Impaired parenting related to infant's loss of fluid. 4. Impaired urinary elimination related to increased fluid intake feeding pattern. The correct answer is 2. Given this infant's history of gastroenteritis, the priority problem would be fluid volume deficit. With gastroenteritis, vomiting and diarrhea occur, leading to the loss of fluids. This loss of fluids is problematic in infants because a higher proportion of their body weight is water. Pain is not a priority problem, although the nurse should continue to assess the infant for pain. There are no data to indicate impaired parenting. Impaired urinary elimination is related to the infant's fluid volume deficit resulting from vomiting and diarrhea associated with gastroenteritis. If the infant's fluid volume deficit is not corrected, then this nursing diagnosis may become the priority. Which of the following will be most appropriate for the nurse to teach the mother of a 6-month-old infant hospitalized with severe diarrhea to help her comfort her infant who is fussy? 1. Offering a pacifier. 2. Placing a mobile above the crib. 3. Sitting at crib side talking to the infant. 4. Turning the television on to cartoons. The correct answer is 1. Typically, an infant hospitalized with severe diarrhea receives fluid replacement intravenously rather than orally. Oral fluids and food are usually withheld, although activities such as placing a mobile over the crib, speaking to the infant, or turning on the television may provide distraction for or helping calming the infant. A fussy infant receiving nothing by mouth is usually best comforted by providing a pacifier to satisfy sucking needs. A 3-year-old with dehydration has vomited 3 times in the last hour and continues to have frequent diarrhea stools. The child was admitted 2 days ago with gastroenteritis caused by rotavirus. The child weighs 22 kilograms, has a normal saline lock in his right hand, and has had 30 milliliters of urine output in the last 4 hours. Using the S-bar technique for communication, the nurse calls the primary healthcare provider with the recommendation for 1. Giving a dose of loperamide. 2. Starting a fluid bolus of normal saline. 3. Beginning an IV antibiotic. 4. Establishing a Foley catheter. The correct answer is 2. The child is dehydrated, is not able to retain oral fluids, and continues to have diarrhea. A normal saline bolus should be given followed by maintenance of IV fluids. Antidiarrheal medications are not recommended for children and will prolong the illness. The child has gastroenteritis caused by a viral illness. IV antibiotics are not indicated for viral illnesses. Strict I&O is important in all children with gastroenteritis. The primary care provider prescribes an intravenous infusion of 5% dextrose in 0.45 normal saline to be infused at 2 milliliters per kilogram per hour in an infant who weighs 9 pounds, or 4.1 kilograms. How many milliliters per hour of the solution should the nurse infuse? Round to 1 decimal. Blank ml per hour. The correct answer is 8.2 milliliters per hour. You multiply 4.1 kilograms by 2. Since it's 2 milliliters per kilograms per hour, you get 8.2. Which of the following will be the best activity for the nurse to include in the plan of care for an infant experiencing severe diarrhea? 1. Monitoring the total 8-hour formula intake. 2. Weighing the infant each day. 3. Checking the anterior fontanelle every shift. 4. Monitoring abdominal skin turgor every shift. The correct answer is 2. Because an infant experiencing severe diarrhea is at high risk for a fluid volume deficiency, the nurse needs to evaluate the infant's fluid balance status by weighing the infant at least every day. Body weight is the best indicator of hydration status because a higher proportion of an infant's body weight is water compared with an adult. Initially, the infant with severe diarrhea is not allowed liquids, but is given fluids intravenously. Therefore, monitoring the oral intake of formula is inappropriate. although checking the anterior fontanelle for depression or bulging provides information about hydration status. This method is not considered the best indicator of the infant's fluid balance. Monitoring skin turgor can provide information about fluid volume status. The abdomen is commonly used to assess skin turgor in an infant because it is a large surface area and can be accessed quickly. However, weight is the best indicator of fluid balance. Which of the following would be an important assessment finding for an 8-month-old infant admitted with severe diarrhea? 1. Bowel sounds every 5 seconds. 2. Pale yellow urine. 3. Normal skin elasticity. 4. Depressed anterior fontanelle. The correct answer is 4. An infant with severe diarrhea will experience some degree of dehydration. In an 8-month-old child, the anterior fontanelle has not closed. Therefore, a depressed anterior fontanelle would be an important finding. Additionally, the infant would exhibit dry mucous membranes, lethargy, hyperactive bowel sounds, dark urine, and sunken eyeballs. Skin turgor will be decreased or delayed. Bowel sounds every 5 seconds would not be considered abnormal for an infant. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which of the following will most likely alert the nurse to the possibility that a preschooler is experiencing moderate dehydration? 1. Deep, rapid respirations. 2. Diaphoresis. 3. Absence of tear formation. 4. Decreased urine specific gravity. The correct answer is 3. The absence of tears is typically found when moderate dehydration is observed as the body attempts to conserve fluids. Other typical findings associated with moderate dehydration include a dry mouth, sunken eyes, poor skin turgor, and an increased pulse rate. Deep, rapid respirations are associated with severe dehydration. Decreased perspiration, not diaphoresis, would be seen with moderate dehydration. The specific gravity of urine increases with decreased output in the presence of dehydration. A child is admitted with a tentative diagnosis of Shigella. The nurse should do which of the following? Select all that apply. 1. Assess the child for nausea and vomiting. 2. Collect a stool specimen for white blood cells. 3. Place the child on airborne precautions. 4. Monitor the child for signs and symptoms of dehydration. 5. Initiate an intake and output record. The correct answers are 1, 2, 4, and 5. Shigella is caused by the Shigella organism. Clinical manifestations of Shigella include fever, nausea, and vomiting, some cramping, headache, seizures, rectal prolapse, and loose, watery stools containing pus, mucus, and blood. The nurse should assess the child for these symptoms on an ongoing basis. Shigella is spread via direct contact with the organism, which is found in the stool. A stool specimen will show increased numbers of WBCs, blood, and mucus. Vomiting and loose stools can result in severe dehydration and electrolyte imbalance. Thus, the nurse should record intake, output, and daily weights. There is no need for strict isolation. Masks are not needed, as Shigella is not transmitted by airborne methods. A mother brings her 3-month-old child into the emergency department. The child is listless with dry mucous membranes, tending of the skin on the forehead, a depressed fontanelle, and a history of vomiting and diarrhea for the last 36 hours. In what order from first to last should the nurse implement the primary care provider prescriptions? 1. Obtain vital signs and weight. 2. Insert an IV and infuse fluids. 3. Apply a urine collection bag. 4. Draw blood for laboratory tests. The correct order is 1, 3, 2, and 4. The nurse should first obtain vital signs and evaluate the child for signs of shock or cardiac arrhythmias. The weight can also be obtained at this time to estimate the amount of fluid lost. The nurse should next apply the urine collection bag. As soon as possible after these steps, the nurse should insert an IV to replace lost fluids, electrolytes, and sugar to reduce the incidence of metabolic acidosis created by the lack of calorie intake and the loss of electrolytes. Blood should be drawn to assess the severity of electrolyte imbalance and other possible causes for the diarrhea and vomiting. A nurse is caring for a 10-month-old weighing 8.0 kilograms who was admitted for dehydration. The infant has vomited 5 times in the last 3 hours and has had no wet diapers in the last 8 hours. The nurse informs the primary healthcare provider, which of the following prescriptions should the nurse question? 1. Begin an intravenous line of D5W.45% normal saline at 40 milliliters per hour. 2. NPO except for medication administration while vomiting persists. 3. Begin an intravenous line and administer a fluid bolus of dextrose 25%. 4. Strict intake and output, weighing all diapers. The correct answer is 3. The infant is in need of a fluid bolus. A fluid bolus should consist of an isotonic fluid, such as normal saline or lactated ringers. Dextrose 25% is not an appropriate bolus for dehydrated children because it could cause a fluid shift that may result in cerebral edema and death. D5.45% normal saline is an appropriate IV fluid for infants. The rate is 1.5 times maintenance for this child and is appropriate for the first 24 hours if the child is dehydrated. Once hydration is adequate, the infant's IV rate should be reduced to a maintenance rate. Vomiting is persistent, so it is appropriate for the child to be NPO. Strict I&O is an appropriate prescription for all dehydrated children. An infant with Hirschsprung's disease is to be discharged 1 or 2 days after surgery to create a colostomy. After teaching the infant's parents about the overall effects of their infant surgery, the nurse determines that the teaching has been effective when the parents state which of the following? 1. His abdomen will be large for a while. 2. When he's ready, toilet training may be difficult. 3. We need to limit his intake of dairy products. 4. We will give him vitamin supplements until he is an adolescent. The correct answer is 2. Toilet training is commonly more difficult for children who have undergone surgery for Hirschsprung's disease than it is for other children. This is because of the trauma to the area and the associated psychological implications. Abdominal distension is an early sign of infection, and therefore the parents need to report it to the primary care provider. Typically, dietary restrictions are not required. Usually, the infant is placed on an age-appropriate diet. Vitamin supplementation is not necessary if the infant's dietary intake is adequate. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When teaching the parent of an infant with Hirschsprung's disease who received a temporary colostomy about the types of foods the infant will be able to eat, which of the following would the nurse recommend? 1. High-fiber diet. 2. Low-fat diet. 3. High-residue diet. 4. Regular diet. The correct answer is 4. A regular diet would be recommended for the child with a colostomy. No special diet is needed. High-fiber foods, such as fruits and vegetables, should be minimized because they increase the bulk in the stool. Fat is necessary for brain growth in the first year of life. A high-residue diet would result in bulkier stools and increased gas production, which will collect in the colostomy bag. Therefore, a high-residue diet is not indicated. When teaching the mother of an infant who has received a temporary colostomy for treatment of Hirschsprung's disease about how the stoma should normally appear, which of the following descriptions about the stoma's appearance should the nurse include in the teaching? 1. Becoming dark brown in 2 months. 2. Staying deep red in color. 3. Changing to several shades of pink. 4. Turning almost purple in color. The correct answer is 2. Typically, the stoma should remain deep red in color as long as the infant has the colostomy. A dark red to purplish color may indicate impaired circulation to the stoma. An infant diagnosed with Hirschsprung's disease undergoes surgery with the creation of a temporary colostomy. Which of the following statements by the parent regarding the colostomy indicates the need for further teaching? 1. The colostomy is only temporary. 2. The colostomy will give time for the nerves to return to normal. 3. The colostomy may include 2 separate abdominal openings. 4. Right after the procedure, the stoma may appear purple. The correct answer is 2. The goal of the surgery is to remove the ganglionic portion of the intestine. The remaining intestines should have normal innervation. Colostomies are used to relieve the obstruction and allow the remaining intestines to return to normal size. A temporary loop or double-barreled colostomy has stomas for both the proximal and distal portion of the bowel. The final surgical repair is usually done when the infant is around 20 pounds. A new stoma is frequently swollen and bruised after surgery. The nurse is showing the parent of a child with Hirschsprung's disease where the ganglionic area is located. Identify the area the nurse should point out as being a ganglionic. 1A, 2B, 3C, 4D. The correct answer is 4. In most instances, the absence of ganglionic innervation occurs in the lower portion of the sigmoid colon, just above the anus. When developing the preoperative plan of care for an infant with Hirschsprung's disease, which of the following should the nurse include? 1. Administering a tap water enema. 2. Inserting a gastrostomy tube. 3. Restricting oral intake to clear liquids. 4. Using povidone iodine solution to prepare the perineum. The correct answer is 3. Before intestinal surgery, dietary intake is limited to clear liquids for 24 to 48 hours. A clear liquid diet meets the child's fluid needs and avoids the formation of fecal material in the intestine. Typically, repeated saline enemas, not tap water enemas, are given to empty the bowel. Soap suds enemas are contraindicated for infants, as are tap water enemas. A nasogastric tube may be inserted for gastric decompression. Insertion of a gastrostomy tube is outside the scope of nursing practice. Because the perineal area is not involved in the surgery, it does not need to be prepared. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. After teaching the parents of an infant diagnosed with Hirschsprung's disease, the nurse determines that the parents understand the diagnosis when the father states which of the following? 1. There is no rectal opening for stool to pass. 2. There's a tube between the trachea and esophagus. 3. The nerves at the end of the large colon are missing. 4. The muscle below the stomach is too tight. The correct answer is 3. The primary defect in Hirschsprung's disease is an absence of autonomic parasympathetic ganglion cells in the distal portion of the colon. Thus, the nerves at the end of the large colon are missing. Absence of a rectal opening refers to an imperforate anus. A tube between the trachea and esophagus refers to a tracheoesophageal fistula. Presence of a tight muscle below the stomach refers to pyloric stenosis. An infant diagnosed with Hirschsprung's disease is scheduled to receive a temporary colostomy. When initially discussing the diagnosis and treatment with the parents, which of the following would be most appropriate? 1. Assessing the adequacy of their coping skills. 2. Reassuring them that their child will be fine. 3. Encouraging them to ask questions. 4. Giving them printed material on the procedure. The correct answer is 3. By encouraging parents to ask questions during information sharing sessions, the nurse can clarify misconceptions and determine the parent's understanding of information. A better understanding of what is happening allows the parents to feel some control over the situation. Assessing the adequacy of the parents' coping skills is important, but secondary to encouraging them to express their concerns. The questions they ask and their interactions with the nurse may provide clues to the adequacy of their coping skills. The nurse should never give false reassurance to parents. At this point, there is no way for the nurse to know whether the child will be fine. Written materials are appropriate for augmenting the nurse's verbal communication. However, these are secondary to encouraging questions. During physical assessment of a 4-month-old infant with Hirschsprung's disease, the nurse should most likely note which of the following? 1. Scaphoid-shaped abdomen. 2. Weight less than expected for height and age. 3. Cyanosis of the fingers and toes. 4. Hyperactive deep tendon reflexes. The correct answer is 2. Infants with Hirschsprung's disease typically display failure to thrive, with poor weight gain due to malabsorption of nutrients. Therefore, the nurse would expect to see a child who weighs less than that which is expected for height and age. A distended, rather than a scaphoid-shaped, abdomen would be noted. Cyanosis of fingers and toes is associated with congenital heart disease. Hyperactive deep tendon reflexes are associated with upper motor neuron problems, such as cerebral palsy. A male adolescent who underwent repair of an inguinal hernia earlier today and is getting ready to go home receives instructions about resuming physical activities. Which of the following statements would indicate that he has understood the instructions? 1. I can start riding my bike next week. 2. I have to skip physical education classes for 2 weeks. 3. I can start wrestling again in 3 weeks. 4. I can return to my weightlifting class in 2 weeks. The correct answer is 3. Because of possible stress on the suture line, physical activities such as bicycle riding, physical education classes, weightlifting, and wrestling are contraindicated for about 3 weeks. A mother asks, how should I bathe my baby now that he's had surgery for his inguinal hernia? Which of the following instructions should the nurse give the mother? 1. Clean his face and diaper area for 2 weeks. 2. Use sterile sponges to cleanse the inguinal incision. 3. Give him a sponge bath daily for 1 week. 4. Give the infant full tub baths every day. The correct answer is 3. The incision must be kept as clean and dry as possible. Therefore, daily sponge baths are given for about 1 week postoperatively. Cleaning the infant's face and diaper area should occur at least daily and continuously, not limited to a 2-week period. Because this type of surgery results in a wound that heals through primary intention, the skin will heal and cover the wound in 2 to 3 days. Therefore, it is not necessary to use sterile gauze to cleanse the incision. Clean technique is acceptable because the incision must be kept as clean and dry. Full tub baths are inappropriate. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.